buat kitab Al-Fatihah. Wait, give me 1 second. Let me look for my. I lost my slide. Wait. Oh, wait. I checked my slide already yesterday. Seems to. Where is it? How many of you?
Should we have 34?
34. Okay. Okay. All right. There it is. Let's see. All right. Sorry, bit problem with my slide. So this is your third posting.
Third posting. Third posting.
Wait, there's a problem. Why I can't open my slide? Yeah, you know. Okay, all right. Sorry for the delay. Okay, there's only 32 of you, yeah? Okay, all right. Can you guys see my slide?
Yes, doctor.
Okay, all right. So today we're going to talk about communication in pediatrics. So this is a relatively new topic in your lecture series. I think we only introduced it in 2000, in the year 2000. Before that, we don't have any lecture or any even discussion about communication in pediatrics. Why this is important? Why we thought that this is an important topic to be discussed with everyone? Basically because the current fifth year are the first batch that is on the new curriculum. So before they were on the old curriculum. So there are several changes. And among them are the introduction of the modified long case, the introduction of the man OSCE. So under man OSCE, so what you have is you have 3 stations. So the first station is a history taking station, where you actually get history in front of your examiners, which you've done in previous postings. So in history taking, we assess how you actually communicate with the parents, how you actually formulate your questions to get the information that you need, and so on and so forth. You'll have the physical examination, where you'll examine the patient, we'll see how you communicate, how you approach the patient, and so on and so forth. And we'll also have the communication station. So in the communication station is basically like, we'll give you a scenario. We have a parent, you have a result, probably the child have something like diabetes insipidus, diabetes mellitus, for example. So you need to counsel the parents. Or you have a child with a simple febrile seizure, you need to counsel the parents, and so on and so forth. So these are communication station. So where we assess how you communicate, how you speak to the patient, and so on and so forth. And if you go for membership exam, MRCP, MRCPCH, MRCOG, all the membership exams, they are communication station. So what we've seen so far is that sometimes Malaysian candidates, they don't perform really well in communication stations. Why? Because we think, probably because our culture, where we don't actually well, we are not as like, if you look at in Western cultures, for example, in Western cultures, they really encourage people to speak out, and so on and so forth. But in our culture, sometimes we don't really encourage people to speak too much. If you ask too many questions, you are being frowned upon, and so on and so forth. So we see that there's a problem. And when I came back from UK, what I saw is that your seniors don't perform really well in communication station. Actually, they perform really badly in communication stations. They don't perform really well, they perform really badly in communication stations. So that is why we think that it is very, very important for us to have a proper lecture on communication, on how to communicate. Furthermore, if you look at data available, you'll see that most of the medical legal cases are actually due to communication breakdown, where healthcare workers do not communicate properly with the patient, and so on and so forth. And this leads to medical legal problem. I'll show you after this. So understanding about communication and practicing proper and effective communication is actually very, very important in healthcare. Okay, what is communication? So this is a Shannon-Weaver communication model. So in every communication, there's always a sender. And there's always a receiver. The sender may be 1 or 2 or more, and receiver also may be 1 or 2 or more. It can be a mass receiver, and so on and so forth. So, but there must always be a sender, and there must always be a receiver. There's no such thing as just a sender, and there's no such thing as just a receiver. There must be two parties involved, the sender and the receiver. So the sender sends message. The message is a signal, and that signal must be encoded. And that signal, it must be able to be decoded for the receiver to actually process and understand. And then the receiver also must produce some feedback. And that feedback must be encoded, and it must be able to be decoded for the sender to actually process the feedback. Feedbacks may be in many forms. Feedbacks can be in response, verbal response. feedback can be in the way of text, like in Zoom, you can text in chat, by facial and body postures, nodding, certain noises macam yeah. So those are also feedbacks. Those are also feedbacks. So there are several things. The first one is the sender must actually understand the message, must be very clear. What is the message? What is the purpose of the message? And it must be encoded in a language that is able to be decoded and understandable by the receiver. For example, if you speak in Malay, but your receiver doesn't understand Malay, how can the receiver decode the message? So that's one thing. Or even like you, like if you want to text, SMS, or WhatsApp, or people don't use SMS anymore. Kan? If you want to send a message by WhatsApp, for example, kan? So the encoding is by texting on WhatsApp. It must be decoded. Maknanya the receiving handphone must be able to decode the actual text that you send and produce it in a readable manner. And readable is something, but if you write things in a short form or in a, I don't know what it's called, this current generation have this short forms which old people like me don't really understand. So sometimes can the receiver actually decode and understand the message? So when an effective communication, the sender must be able to encode the message, and the receiver must be able to decode the message and actually process the message. And you must always remember, there's always this noise ni dekat in between the decoding and encoding. So what happens with the noise is sometimes when you communicate, when you speak to your friend, for example, there's a lot of noise in the background, muffles the sound. Or sometimes there's a Wi-Fi problem, for example, kan, you send message, the message is encoded, it's sent already, but there's no Wi-Fi. Wi-Fi dekat mahalah problem, for example, and then that message cannot be sent to the receiver. The receiver cannot receive the message. Receiver battery habis contohnya, so it cannot receive the message. So these are all noises that can disrupt the communication process. So sender, encoding of signal, decoding of the message, processing of the message by the receiver, and receiver give the feedbacks which is encoded and decoded and processed by the sender. And all this can be disrupted by the noises. Noises can be disruption. Contohnya, I'm speaking to you now. There's an announcement by suspect. Can you hear that announcement? Boleh dengar tak?
Boleh.
Dengar, is it loud?
Sama-sama.
So these are all noises that disrupts communication process. Yeah, disrupts communication process. Because you need to remember, now is the age of virtual clinical sessions as well. SUSMEC, we've been for the past 1.5 years, we've been thinking of how to do more virtual type of clinic assessment, for example. Actually, several departments have already started. Several departments in SUSMEC have already started virtual punya review, because not all outpatient clinic reviews we need to actually examine the patient in detail, kan? Even like skin, dermatology, you don't need to actually see and touch. Well, it's better for you to see and touch, but sometimes you just need to see, and for seeing you can just see through video, through photos, and so on and so forth. So many departments are thinking, and I personally I have a phone number that I give to my patients, and my patients regularly send me videos, photos of their child. So sometimes they had a rash, they had some abnormal movements. So they show me and then I discuss and I advise them accordingly. So these are all virtual types of clinic review. If you go to other developed countries, for example, they are not just doing virtual clinic reviews, they are even doing AI clinic reviews. So artificial intelligence. So where the first assessment is actually by artificial intelligence. So patients call this number, they do virtual punya session, and they are not actually communicating with the doctor, but with an AI. So things are moving fast, and I can assure you. So, and I can assure you, the time when you all become doctors in 2-3 years time, things will change more. You'll have more virtual type of setting. You'll have more AI involvement. There are now postgraduate degrees about how artificial intelligence can involve in healthcare. So I think things are changing. Is whether we are adapting to it or are we behaving like Nokia, for example, refusing to change, and whether we'll finally lose or something, we don't know. Okay. Why is communication very important? Most of it I've talked about before, but if you see here, in 2015, CRICO from Harvard Medical Institution published a paper. It says that communication failures are linked to more than almost 2,000 deaths in the past 5 years. Communication was a factor in 30% of the 23,000 cases filed for medical legal litigation from 2009 to 2013. And of that, 48% are ambulatory setting, maknanya outpatient. 44% are inpatient and 8% emergency department. Well, we assume in emergency department, they don't have much time for so basically emergency usually is very brief. The patient don't stay there for long and so on and so forth. So when they look at all the malpractice issues, most of it is actually miscommunication of patient's condition. So when you do not communicate properly the problem with the patient, you don't have inadequate informed consent, you have poor documentation of the patient's problem and discussion and so on and so forth, and healthcare workers showing unsympathetic response to patient punya complaint. Patient complain, they ignore and so on and so forth. Failure to properly read the medical records and inadequate patient education regarding the medication. So they don't understand how to take the medication and they sue the hospital. So it's very important. So what I'm trying to say is proper effective communication is actually essential in healthcare. It's actually very, very important. What are the challenges? So among the challenges are nurses are the ones that spends more time with the patients. So usually doctors, we don't spend as much time with our patient as compared to the nurses. So that's one thing. Secondly is especially in healthcare, there's a lot of non-verbal communication involved. Our expression, we got more of procedures, we got more physical examination. Again, physical examination is also, there's also a communication element in physical examination, because you need to break the ice, you need to speak to your patient, you need to make sure that they are not in pain and so on and so forth. So there's a lot of communication element as well. There's a lot of communication element as well. And especially for children, especially for pediatric department, we are not only communicating with the patient, but we are also communicating with the caretaker, with the parents. And there's also element of communication in between the staffs. In between the staffs. How you, among the medical students, communicate with each other, with your lecturer, with the MOs. And all these are reflected on the quality of healthcare that you are giving. Because, for example, if you talk about the patient, where the patient can hear, about something about other diseases. You talk about a patient ni diagnosis lain, and then you talk about cancer, for example. Ataupun patient ni memang ada cancer, and the prognosis is good, but you did not communicate properly. You communicate between the staffs, saying about the grave grave prognosis, for example. So that can result in a lot of problem in taking care of the patient, or in a patient with very poor prognosis, and in a patient who's already brain dead, for example. And then there's a lot of chit chat among staff saying that, oh, this type of patient, if we send to this Tok Bomoh, for example, the patient can be cured. Then that can result in a litigation issue. That can result in a breakdown of proper clinical care. So communication that we have in healthcare involves how we communicate with our patient, how we communicate with the caretaker, the relatives, and also how we communicate in between among our staffs as well. And we need to remember as well, everyone has different personalities, and different personalities needs to be communicated differently based on their different personalities. Okay, the first element in communication in pediatrics. The first thing you need to remember is that children are not just small adults. Children are not just small human beings. They are not mere homunculus. They are not mere homunculus. They are not small adults. They have different cognitive development capabilities. They have different motor and speech and social development capabilities. And all this difference in between them actually results in how we communicate with them. It does not mean that we need to communicate with them with baby talks. No, it does not mean if the child is able to coo only, cooing, then we need to speak in cooing language with them. No, if they can babble, we speak babble with them. No, it means that we still need to communicate properly, but we need to acknowledge what's their level of cognitive, what's their level of motor, speech, and social capabilities. We need to acknowledge them, and we need to treat them accordingly. So they are not mere human. They have different developmental capabilities. They have different upbringings. Different upbringings results in different way of communication. So if your upbringing is very vocal, for example, it's going to be very easy for you to get history from the children. But if their upbringing are very shy, very introverted, very indrawn, so it's going to be very difficult for you to actually get break the ice, to build rapport with them. So understanding upbringing is also very important, and also parental expectation. Okay, next, newborn are still to be communicated with. Even newborn babies, you still need to talk to them. If you want to prick a line, for example, you want to do venipuncture, you should not just ambil tangan baby, terus cucuk. No, you go and acknowledge them. You speak to them. Kan? Yes, they don't respond accordingly. You akan kejut lah kalau tiba-tiba budak tu bercakap kan. But you need to actually communicate with them as well, because newborns, they do respond to social cues. They understand social cues. Yes, they cannot smile yet, because social smile appears around 4 to 6 weeks. They don't actually smile back to you yet, but they do understand. They do understand some of the social cues. They can sense parental voice exposed antennatally, so they are used to listen to their parents' voice. As you know, the first sensory that is developed is actually hearing. Inna sam'a wal basar, you get listening first and then visual. So newborn children, antennatally, they are exposed to their parental voice, so they know that this is a common, this is a normal voice, this is the usual voice that they are supposed to listen. And you do need to read to them. So studies have shown newborn babies who are being read to, kalau kita baca buku pada babies tu, so they have faster literacy, they have better literacy rate. They are able to read much faster as compared to other children of their age. For example, so reading to newborn babies is very good. It's very, very good, even though they don't actually understand. But because newborn babies, they absorb, it gets into the subconscious mind, and it helps them to actually learn later on in life. Okay, so read to newborn babies. Number two is rhythmic sounds. So rhythmic sound studies have shown children and newborn babies who are exposed to certain rhythmic sounds, they respond better. Even if they are ventilated, intubated, if they are exposed to certain rhythmic sounds, they respond and recover better. For example, studies, most of the studies are talking about classical music, for example, classical music, and also certain Quranic recitation with tartil, waratilil Qur'ana tartila. If you read Quranic verses with tartil, it also helps in terms of development and recovery of newborns, even in NICU setting. So if you come to our NICU, you see that we are always playing this Quranic recitation at the background. Okay. The next thing is I want to say, as I have mentioned before, communication is not just about talking. Communication is not just about talking. History taking is communication. Physical examination is communication. So whenever there is interaction between human being, hablum minan nas, whenever there's communication between human being, there is communication. And communication not just involves auditory punya communication, it can also be visual, it can also be whatever. So it's not just about what you talk about, it's not just about talking, it's also about doing and so on and so forth. So everything is actually communication. Okay. Next is you need to plan the session where you communicate with the patient, with someone else. Ideally, it should be a planned session. How you plan? First, it must have a clear objective. Innamal a'malu binniyat wa innamal likulli imri'in ma nawa. Faman kanat hijratu ila Allah wa rasulihi fahijratu ila Allah wa rasulihi. Faman kanat hijratu ila dunya yusibuha aw imra'atin yankihuha fahijratuhu ila ma hajara ilaih. So whatever you do in this life, you must have a clear objective, because whatever you do, the outcome is based on your objective. If your objective is Allah and Rasul, you will get Allah and Rasul. If your objective is ila dunya, you will get it. You see what? And so everything must have a clear objective. Same as your communication. What is the objective? Is the objective for you to get the history, for you to make a diagnosis? Then you will get it. So you must have a clear objective. Is it to actually discuss with the parents about diagnosis? Discuss with the parents about next steps in investigation? Is it about communication or breaking bad news, for example? So what is the objective? The objective must be very clear. There's no such thing as lalang jumpa nak cakap. No, there's no such thing as that. And so there's always an objective. And the communication must involve appropriate personnel. For example, if it is a potential medical legal issue, you should not just be the most junior personnel. If it's a potential medical legal issue, you should have the most senior personnel around. You should have the consultant. You should even have the director of the hospital to be around, or his representative, or you need the legal advisors to be around, for example. Do you need a nurse to be with you to actually be chaperone? Do you need the other relatives to be together with you? Sometimes you need personnel to actually translate. Sometimes you need personnel to actually give a shoulder for them to cry, for example. So appropriate personnel. So sometimes if there's a medical error, for example, someone did an error that caused a problem to the patient, for example. Do you need that person to be in the setting for you to discuss? So sometimes no, because sometimes it may create more disharmony. Sometimes it may create more anger and so on and so forth. So you need to plan. who are the appropriate personnel for you to be in that communication punya setting. So that is why objective must be very clear. You need to involve the appropriate personnel. Ideally, it should be on a scheduled time. You need to plan the time. This is scheduled time. So we're gonna meet even in 2 minutes. So let's have this discussion in 2 minutes time. Because in 2 minutes time, you still can plan what's the objective, who else do you need with you, what else you want to talk about. So it must be scheduled time. You need to have adequate preparation, information, personnel. You need to ask them, okay, what are the, we have a meeting tomorrow. Do you have questions that you want to ask? Then I can prepare early on, for example. So get the questions, get the concerns of the patient, and so on and so forth. So early on, before the setting. Bukannya masa nak meeting baru kata, okay, ada soalan tak yang nak kita discuss dulu? No. Sometimes you can even ask early on. So you get the questions early, ataupun you can just before you begin and tell deeper, you just ask him any questions first before we discuss. Any question that you want me to answer first. So get all the background things ready before the setting. Next, setting of the session. So what's the setting of the session? First, it must have privacy. It must have privacy. For example, if you're talking about, if you're doing breaking bad news, for example, or if you're talking about, well, we have sometimes children with certain problems. We take some blood, and then we have babies who are positive for syphilis, for example. We need to start treatment for 2-3 weeks of treatment because of syphilis. We cannot just write on the bed, syphilis. Everyone can see, oh, this baby has syphilis. No, we need to protect the privacy of the patient. We cannot just mess around, kuat-kuat kita cakap, so this patient with syphilis, this one is HIV. No, we need to have a privacy. We cannot counsel mother, dekat bagi tahu mother, baby ada HIV, for example, baby ada syphilis, where other parents, other patients are also listening. That's not okay. So we must have a privacy. And whatever the diagnosis, even diagnosis asthma saja, you must protect the patient's privacy. We had one patient before. The diagnosis was tuberculosis. Diagnosis, this patient I think was just 4 years old, 4 or 5 years old macam tu. Dia ada persistent lymphadenopathy. And then we did biopsy, suggest of tuberculosis. So the diagnosis is tuberculosis, but the parents are so concerned. They tak concerned pasal disease because they tahu disease tu is not causing much problem to the patient. They're not concerned about the medication because even though medication tu ada cause lots of problem, but they're not really concerned about it because they know we are actually monitoring. But what the mother is actually worried is the privacy. They don't want other patients to know about the diagnosis because they think that if the diagnosis is tuberculosis, they will be shunted. Semua orang akan takut, oh tuberculosis, TB, budak kena TB, semua orang akan jauh. Semua orang akan assume, oh ni ada HIV lah, apa benda. So they are more concerned about that. They are not even concerned about medication. They are not concerned about the disease. They are concerned about the privacy issue. They don't want other people to know the diagnosis. So this is an issue that we need to settle. So the setting of the session, it must have privacy. You must protect the privacy of the patient. And then it must be comfortable, ideally in a sitting punya setting. Maksudnya sitting. So sometimes I've seen before, ada doktor buat breaking bad news standing. Berdiri, cakap, minta maaf, anak ni macam very bad, I think the child is gonna die. Standing. So apa jadi? Parents dia jatuh kan sebab dia terkejut with the bad news kan. So daripada satu problem jadi banyak problem lain. So that is why you need the session, the setting must be comfortable. You must have appropriate personnel, as I have mentioned before. Do you want to talk about discharge planning? Do you need dietitian to be with you? Do you need nutritionist to be with you to counsel about how to give the nutrition? how to give the feeding for the child. Do you need physiotherapist? Do you need occupational therapist? Do you need surgeon? Do you need endocrinologist? So who do you need to be with this with you for the session? You need to have appropriate personnel. The room must suit the purpose. And for example, if you want to talk about, so we have babies here, extreme premature babies, where before discharge, we teach the parent how to do basic life support, how to do CPR, for example. So the room must be suitable. You need to have appropriate equipment, appropriate room, appropriate equipment. And ideally, there should not be disturbance. Dia tak boleh tengah you cakap ni tiba-tiba ada announcement lah, ada apalah. There's a lot of disturbance. There's a lot of disturbance also. It's not ideal. Next, introduction. So in whatever settings of communication you have, it can be the communication setting, it can be for counseling, it can be for history taking, it can even be for physical examination. The first thing you need to do is introduce everyone. Kena bagi tahu. This one I've seen of even your seniors dalam history taking, dalam physical examination, they don't introduce themselves. For the last batch is better, but before this, kadang-kadang tak introduce pun. So you need to introduce yourself. Saya ni siapa? Not just your name, but who are you? Are you the medical student, or are you the house officer? Are you the specialist? So introduce yourself. And not just yourself, introduce all the attendees. Ni siapa, ni siapa, ni siapa, ni siapa. And not just introduce them, introduce their role. Kan? Saya pediatrician, tapi hari ni saya kerja sebagai pencatat saja. Kan? So, you need to mention the role. Ada staff nurse. Apa kerja staff nurse kat situ? Kan? So, I'm a pediatrician, but my role today is just to document. The counselling will be done by my diabetic nurse, for example. Kan? So dia yang cakap. So you need to introduce the role of everyone who is present. Kenapa orang ni kena ada dalam that session tu? So you kena introduce them. And you get consent. Okay, so hari ni kita nak discuss pasal penyakit anak yang ni. Kita nak plan pasal kita punya further plan and management. Boleh ke? Okay ke? Can we do this? Hari ni kita jumpa untuk kita buat physical examination. Saya nak tengok keadaan anak macam mana. Saya nak periksa anak, boleh. So you get consent for you to proceed with the session. Why? Even though the patient come for exam, for example, they already gave consent to be a patient for the exam. You still ask consent from them. Why? Because when you ask consent, when people give consent, subconsciously the barrier is broken. The barrier is broken. It's going to be easier for you to actually approach them. Next, ascertain the objective. As I mentioned before, innamal a'malu binniyat. Whatever depends on your niyat. So, and that intention, that objective must not just only be known by you, but that objective must be a shared objective. Maknanya, everyone in attendance should understand and agree on the purpose of the session. Tak boleh lah you punya objektif, you nak terangkan pasal disease of the patient. Parent punya objektif saja nak gaduh dengan you. Tak boleh, tak jadi. Kan? Parent punya objektif lain, you punya objektif lain. So when there's no matching of objectives, no matching of purpose, the session will be purposeless. So for it to be effective, the purpose, the objective must be a shared objective. If everyone has wahdatul niyah, then the objective is going to be achieved. That's why too, everyone must know the purpose of the session. Everyone must understand the purpose of the session. So that's why lah. So again, in communication setting, you inform, you get consent and you inform apa objektif. So hari ni kita nak jumpa dalam exam ni, saya akan tanya pasal masalah anak ya. So you get the consent, you inform the objective, what you are trying to achieve from that session. Next is know the background. Know the background ni maknanya kalau dalam session, for example kan, you tanya dia lah, tanya. So puan kerja apa ya? Boleh saya tahu. Suami kerja apa? belajar sampai mana, rumah dekat mana. So you get a bit of a background. Why? It's very important because when you understand the background of your attendees, first is you know the language that they are talking. So I've seen before, we call parents to come for counseling, for discussion of the disease. Sekali parents tu tak cakap Melayu. Bukan tak cakap Melayu, tak cakap English. Kan? Parents cakap Burmese, for example. They are Rohingyan. In UAE, we have a lot of Rohingyan patients. They only speak Burmese. So, apa purpose kita panggil dia susah-susah? Dia orang adalah orang susah. They are very poor people. For them to come to the hospital, they need to pay Grab because they don't even have motorcycle. So coming to hospital cost money to them. We call them and we cannot even speak to them. What sort of shithousery is this? So you need to know the language that they can speak to. If they only speak Burmese, so you need to get someone who speak Burmese to be your translator, for example. And I've had before patients who only speak Chinese. Who only speak Chinese, ada banyak language. There's 100 of language Chinese. They can only speak Mandarin. I have patient before. Dia ada complicated punya cleft lip and cleft palate. So we need to speak with the parent, and parents only understand Mandarin. So we need to get people who speak Mandarin to actually come for the session. So you need to know the language. You need to know the level of education and work that they are doing. Why? Because, for example, if your patient is a doctor, you cannot speak with them in a layman punya language because that is insulting to them. That is insulting to them, and it doesn't make them understand the problem. So Islam also teaches us khatibun nas ala qadri ukulihim. Khatibun nas ala qadri ukulihim. So you speak to people based on their level of understanding. And so you speak to them at their level. If they are nomads, orang asli, not even go to school, you cannot speak in a high level of language. You need to speak in a lower language. You need to speak in a layman term. Do not use jargon. You are not actually ridiculing them. Kita bukannya merendah-rendahkan dia. When we speak at their level, we are not actually merendah-rendahkan dia. We are actually acknowledging them. We speak at their level to acknowledge and kiram, memberikan kiram ni maknanya memberikan respect. We are respecting them. So that is why we speak to them in a proper language. And one thing that I never see students do is that assess the level of prior understanding. Why? Because sometimes when you want to talk about something, many people have spoken about that. You have a patient with diabetes mellitus, diabetic ketoacidosis, for example. You are not the first person to talk about diabetic ketoacidosis. So it's gonna be very good if you ask first. Puan, hari ni kita nak discuss pasal penyakit anak ni. Saya rasa kita nampak macam dia ada, kita nak discuss pasal penyakit anak ni dan keadaan dia datang. Sebelum ni ada doktor pernah cakap dah ke? Mak tahu ke apa penyakit dia? Mak tahu ke apa diagnosis dia? Mak tahu tak apa doktor lain pernah cakap dengan mak? Apa yang mak faham pasal penyakit anak ni? So even before you start the discussion, you ask them. So this is the objective. What do you understand about this objective? Then, because why? When you ask them what they understand first, then you can elaborate on it. Rather than you begin from A, you can begin from W or somewhere. So, and you can rectify any misunderstanding. So, contohnya, sebelum ni information pasal meningitis. Semua parents tu dapat daripada Tok Bomoh, for example. Obviously, there's going to be a problem. Sebab Tok Bomoh akan kata makhluk halus. Which is right lah. Sebab makhluk halus is microorganism. Kan? Not just jin. Kan? So, if they got misinformation from other sources, then you have the time to actually rectify the misinformation, and then you expand on it. So that is why always ask the level of prior understanding. So apa yang dah faham, apa yang doktor lain cakap sebelum ni. Even as specialist now, whenever I speak to parents, one of the first thing I ask is, because I know already before I speak to the patient, my MOs, my HOs, my nurses have already spoken to them. So I ask them, what have other people told you about the problem? What do you understand about the problem? So if anything, we can rectify, we can clarify the misunderstanding, we can clarify, we can expand, and we can focus on the more important aspects. Tak payah, sebab kalau if every time someone talks to patient, dia begin from A, apa kita akan rasa? Semua orang akan sakit hati, semua orang akan frustrated sebab kita start daripada basic balik. Macam you dah year 3 kan? Every time lecture start daripada year 1 punya lecture. You stress tak? Obviously you will be stressed out. So that is why you assess the level of prior understanding. When you're year 3, we not just assume, we know because you've had exams before. So we know for a fact that you should already understand what you've been taught in year 1 and year 2 because there is already an exam. And we can see all the results, so we know already. So that is the thing. So understand the level of prior understanding. And what is the expectation? Okay, Mak, hari ni kita ada session nak discuss pasal penyakit anak ni. Ni objektif dia. Kita dah assess apa yang Mak faham, apa yang Mak harap daripada sesi kita hari ni. So you know, you try to gauge what is the expectation even before you begin the session. So that is the objective is for you to actually achieve what is being expected. Next, assess understanding, assess the prior understanding. Yeah, I mentioned before. Next is use language accordingly. Use language accordingly ini maknanya first, if you need language line, if you need translator, so get the translator to be around. And if you don't speak the language, get the translator. Sometimes ada people yang boleh cakap minimal about a language, qalilan jiddan, sikit je, qalilan jiddan, nitnoy in Siamese, nitnoy. So sometimes they can speak shwai, they can speak very minimal certain language. So even if you speak very minimal, you can do communication level, for example. Sometimes the message may not be able to be effectively communicated well. Sebab the range of vocabulary is limited. Kan, I've seen before a Rohingyan patient, for example, they can speak minimal Malay, but the communication may not be effective because they won't understand the gravity of the problem, for example. So you need to make sure that language is being settled. If you need translator, get translator. The next issue is avoid jargons where appropriate. If you look at the marking rubric for your exam, communication station, there's always the item avoid jargons, not use jargons, because if you use lots of jargons, it tells us that firstly you don't respect the level of understanding, the level of knowledge that the patient have, number one. Number two is that it tells us that you don't actually understand because you remember the words but you do not know how to describe that word in a layman punya term. Albert Einstein said that genius is the ability to convey something something complicated to a layman. Genius is the ability to communicate something complex to a layman. So you need to be able to explain the complicated medical issues in a layman term so that the patient can understand. But there are times when you need to use jargon because you want the parents, you want the patient to actually understand and use the certain jargon that you expect. For example, G6PD deficiency. And you want them to know that this is G6PD deficiency. You cannot just kata ini masalah enzim kurang. No. You want them to learn the word G6PD deficient. You want them to learn DKA. You want them to know urine protein. Kan, you tak boleh lah bagi term yang lain kan. So certain terms you want them to learn the jargons. Jangan jadi sampai mat jargon lah. Kalau korang kenal lah siapa mat jargon tu, tak kenal tak apa. Next is cover the concerns. Cover the concern, apa kerisauan, apa yang benda yang the parents are worried about. You need to make sure that you are hilang. So a certain apa problem dia, apa issue, what are their concerns, you assess them and you make sure that you have covered, you have settled, you have covered every of the concerns that they have. Reassess the understanding. I've mentioned before you begin, ask their level of prior understanding, but in between, after 5 minit, you assess balik, okay, kita dah 5 minit cakap pasal problem ni, apa yang mak faham? Setakat ni apa yang mak faham? Faham tak? Clear? Cuba ulang balik apa yang telah kita discusskan sebelum ni. So you reassess the level of comprehension several times. And at the end of the session, formulate a conclusion together. Okay mak, kita dah discuss dah. Sejam dah kita discuss ni. So apa yang mak faham? Okay, first anak ni ada diabetes. So diabetes ni kena treatment kan? Okay, treatment. Okay, ubat nak bagi macam mana? So you formulate a conclusion together. So anak ni ventilated dah banyak kali dah, very bad, very high setting ventilation, tak ada respon, very bad, persistent, severe metabolic acidosis, eyes, pupils dah fixed dilated dah. Apa kita nak buat lepas ni? So setuju kan, kita tak payah chest compression dah. Kalau dia extubate, kita extubate dah. Tender loving care, tak payah dah penot for active resuscitation. Okay ke? So you formulate a conclusion together with the parents, together with the patient. So baru the next steps of treatment is gonna be a cumulative, maknanya dia will be a joint punya plan, bukan you yang seronok buat plan, patient ikut je. No, they are involved in the planning of their own care. So formulate a conclusion together. Okay, some important points. The first one is empathy. So empathy is not sympathy. Empathy is not sympathy. Can you be emotional with your patient? Can you be emotional? So my answer is you can be emotional with your patient, but you should not be emotional towards your patient. You can be emotional with your patient, but you should not be emotional towards your patient. If you have a baby who's dying, if you have a baby who died, it's okay for you to cry together with the parents. I have cried many times with the parents of my patient. It's okay, because when you cry with them, when you are emotional with them, it shows that you are caring for them. It shows that you are with them. You are not against them. So, but you must show appropriate emotion. Maknanya, kalau tengah sedih, you kena buat sedih lah. Kan? Kalau the patient is dying, you must show sadness and sorrow. You cannot, anak meninggal kan, you buat muka happy. Mak, itulah, minta maaf lah, anak ni meninggal lah ni. Muka senyum-senyum. It's not appropriate. Kan? Tak boleh pula berita gembira kan, you buat muka sedih. Mak, itulah, berita gembira ni. Anak ni rawatan kemo dia dah berjaya dah. Berjaya dah. Sihat dah dia. Boleh balik dah. So tak boleh, tak appropriate. So good news must be accompanied with happy punya facial expression, happy punya emotion. Sad news must be accompanied with sad punya emotion. So emotion must be appropriate. It's not just you who are talking, it's also the surrounding. Surrounding tu must be appropriate. Maknanya tak boleh lah you tengah cerita benda sedih, kat belakang ni tiba-tiba ada lagu happy-happy punya. Tak boleh lah. Kan? It must be appropriate. And you must try and understand the feelings of their parents. It's not easy. It's never going to be easy. So, you must show empathy. And empathy ni, dia daripada facial expression, dia daripada the tone of your voice, the frequency, the pause in your voice, your demeanor, and so on and so forth. The ambience of the area, for example, so everything affects. Everything shows how empathy you are towards your patient. Next is open-ended question. Use open-ended question appropriately. Sometimes you do need to use close-ended. Sometimes you even need to use open targeted type of questioning. Open-ended questioning ni maknanya macam mana? Rather than you ask, okay, ada batuk ke, ada demam ke? So because if you ask ada batuk ke, kan, the answer is yes, no, that's it. Tak ada jawapan lain. Dia tak ada macam ada batuk ke, batuk dia macam ni. No, it's not descriptive. It's a yes or no questioning. So that is bad in medical. So what type of questioning? You should ask things like, okay, apa masalah ya? Kenapa datang hospital? Apa menyebabkan dia datang sini? Kan, cuba cerita. So sometimes you need to use open targeted questioning. Ada demam. Okay, demam dia tu macam mana? Cuba cerita pasal demam dia. Cuba describe pasal dia punya batuk. So you go for open targeted questioning. But sometimes you have certain checklist. Macam contohnya your provisional is meningitis. Dia ada you nak tanya pasal high pitch cry, irritability, neck stiffness, kan? Seizure, projectile vomiting. So these are checklists yang you need to tick, kan? So you kena tapi ideally you tak tanyalah ada irritability tak, ada seizure, ada ni tak. So because if you ask like that, it's just a yes and no. Sometimes if you use yes and no type of question, you are actually feeding words into the mouth. So bila you feed words into the mouth, sometimes dia akan kata yes or no, sampai atau dia akan ulang balik what you said before. And that's a problem. You may get false positive or false negative punya info. So that is not right. So ideally sometimes you kena give option. For example, nafas dia ada bunyi tak? Kan? Cuba cerita bunyi nafas macam mana. But sometimes people cannot describe. Dia tak boleh nak describe wheezing. Kan? So you bagi option lah. Nafas dia ada tak bunyi macam whistle, bunyi macam ni ke, atau bunyi macam kasar macam tu, atau bunyi macam berdengkur ke? You give options. Because if you only give one option, nafas dia ada tak bunyi macam whistle, bunyi macam ni macam tu. So you are giving only one option. So some people, especially kalau dah banyak jawab, kadang dia akan just kata yes or no macam tu je. And so sometimes it's better for you to give option rather than just one single option. So give multiple options for them. So ideally always use open-ended. Apa masalah, sakit apa, allow them to describe, more of descriptive. Batuk dia macam mana, napas dia macam mana, cuba cerita bunyi yang pada napas dia. Macam mana cara dia, mak kata dia macam lemah tu macam mana. And you need to remember certain words in Malaysia is a bit difficult. For example, lelah. What is lelah? Lelah ni maksudnya apa lelah? Lelah apa lelah? Ashraf, lelah ni apa lelah?
Semput.
Semput. What does it mean? Semput tu maksudnya apa?
Channel of breath.
Shortness of breath. The problem with lelah ni can mean many things. Anak saya lelah, doktor. It can mean a diagnosis of asthma. Anak dia memang ada diagnosis asthma, but not in shortness of breath sekarang. Anak saya lelah. What does it mean? Kan? Does it mean anak dia ada diagnosis of asthma before? Or lelah ni can mean shortness of breath. Lelah can mean dyspneic, lelah can mean tachypneic, lelah can mean tired. Oh, lelah lah tengok. Lelah bagi teaching. It can mean so many things. Kan? Lelah bagi lecture pasal communication in peace, communication station setakat ni semua teruk belaka. Kan? So lelah saya bagi lecture. So lelah can mean tired, lelah can mean fatigue, lelah can mean so many things. So you need to ask them to describe. Mak kata lelah tu apa maksudnya? Ask them to describe. Ask them to describe. Apa lagi banyak term lain? Contoh teriak. Kan? Teriak mean so many things. Teriak can mean jerit, teriak can mean cry, kan? Teriak has many meanings, kan? So understand the meaning behind all the behind what they are doing, behind what they are saying. Kan? Anak saya napas bunyi. What does it mean napas bunyi? What type of bunyi? So you need to ask them to Describe, describe. Okay. Next is always be a good listener. You need to be an active listener. Only a good listener can be a good speaker. You can only convey the appropriate information if you listen properly. If you are not willing to listen, you will not be able to be a good speaker. A good speaker is only someone can only be a good speaker if that someone is a good listener. And listen to understand, not to respond. Bukan respin, Listen to understand, not to respond. Ada people, dia dengar kan sebab dia nak respond. Ada people, dia dengar lecture sebab dia nak kutuk kat Facebook lepas tu kan. Ada people dengar lecture Dr. Syed, nak tunggu nak record sikit, lepas tu dia share, ni doktor ni apa-apa cakap ni kan, gagap lah apa, for example. So some people, they listen to actually respond, and that is not good. You should listen to understand, not to respond. And a good listener responds with body language, with good eye contact. Can you imagine? Bila you cakap, cuba you try lepas ni, cakap kan, cakap, seorang tu pandang tempat lain, you cakap dengan dia pandang tempat lain. There's no eye contact. That's a problem. You pernah try tak cakap dengan orang yang juling, ada screen? It's very difficult. So you don't know where they are looking at. Kan? So you must have good eye contact. There's only one speaker yang tak ada eye contact pun tapi very effective. So far, I've not seen anyone else. Because so selalunya kalau orang bagi lecture kan, dia kena ada eye contact, dia kena pandang pada the listener. Dalam Zoom ni tak tahulah, dalam Zoom mesti you need to look at the exact Zoom. Can you imagine if I'm giving lecture dalam Zoom, but I'm looking here, then I bagi lecture macam tu. How would you feel? Even though you see my video ni kecil je kat situ, you see my slide is bigger, my video kat situ kan. Tapi if I don't look at you, kan, you won't be effective. You won't be effective. There should be eye contact. But there's only one lecturer, there's only one speaker who speaks without eye contact, but very effective, which is the previous Menteri Agama. Dr. Zulkifli Al-Bakri. His eye contact is very poor. He don't look at the listeners. Di pandang bawah. But I think it is because the way he formulates his intonation and the frequency of his voice is what makes his speech usually very interesting. If you look at his lecture kan, dia tak pernah pandang pun the examiner. Kadang-kadang dia pandang sekejap kan, but most of the time dia bukan pandang kat nota pun. He just looks down. But his speech usually are very powerful. I think it's because for a good speech kan, dia ada eye contact, dia ada facial expression, body language, intonation, pace of your speech, and also pause, where you pause. Maknanya important points usually slower pace. Point yang penting, slow pace. Less important point, you go with faster pace. And you pause between points. Ni point nombor 1. Point nombor 2 macam ni. Point nombor 3. So in between points, you pause. So all those are elements of a good speech. So I think it's very interesting and it's very important lah. So go and look at all the other speakers. Okay, all right. We are a bit long. Okay, so then there are other non-verbal punya elements which I've mentioned before. Intonation kan, your tone. Sometimes more important points you go with higher intonation. This is a very important point kan. This point is less important, so the tone is a bit lower kan. Facial expression important, less important. So facial expression is important as well. Actually 80% of effective communication is actually non-verbal kan. Cuba if I tell you macam ni, you boleh nampak my face kan. If I say this topic is very, very important, as compared dengan this topic is very important kan. My eyebrows, my eyes, the tone, the frequency. Yeah. So it shows the importance and gravity of the situation. This is extremely important as compared dengan this is extremely important. Yeah. So the message is gonna be different. It shows that there's no honesty, there's no tak ada keikhlasan dekat situ. So non-verbal is very important. Intonation, facial expression, body language. Your hands, kalau you punya tangan semua macam ni. So this is a defensive body language. If you speak like this, you are being defensive. So people akan subconsciously starts to reject. So you should go for open body language. Tangan tu kat mana? Your hands are very powerful. Because your hands, kalau dekat homunculus in your brain kan, your hands occupy a very large area. So your hands are very powerful. Position ni macam mana? Sometimes that's why if you see dulu bila kita cakap dengan patient kan, kita go depan-depan, opposite, ada meja tengah-tengah. So it subconsciously shows that we are opposite to our patient and there's a barrier in between us. So that barrier actually affects subconsciously and affects the acceptance. So, sebab tu sometimes sekarang ni kalau kita go opposite pun kita akan ada tepi macam tu, dia tak ada, ideally tak ada barrier in between us. And some people sometimes they go in 90 degree, doktor pandang sini, patient pandang sini. So in 90 degree, at least it shows that we are not against, we are not opposite to you. And sometimes better kalau macam contohnya you are breaking bad news, it's very good for you to be by the side of the patient. Patient pandang sini, you pun pandang, you sebelah dia pandang depan, pandang the same direction. Because when you are beside them, in the same direction with them, it conveys the message that you are with them, you are not against them. So those positions are very, very important, very, very powerful tool. Next is ambience of the room. Ambience must be right. And sometimes you can use element of touching. I'm not going to go with that. But sometimes when you touch patient, you give tissue, you touch patient sedih, you pegang bahu dia, kan? It conveys a very powerful punya message. Mirroring, we're not going to go with mirroring as well. Spikes. So if you look at papers, studies, they've been discussing about spikes as a very powerful punya communication tool. So what is spikes? As for setting up the interview must be set up properly. You should mentally rehearse, plan apa nak cakap. You should arrange privacy. You should sit down, use open body language. P for perception. You elicit the patient perspective, apa pandangan dia, apa dia understand, apa dia punya issue, assess what's their belief and what do they feel about the issue, what do they feel about the problem, assess the vocabs and comprehension, assess their understanding. I for invitation, ask the patient what they want to know. So rather than you explain to them, terus you ask them what they want to know and you explain what they want to understand. Because you need to remember, people, we only listen to what we want to listen. We understand to things that we have a bit of an idea before. So invite them. Obtain permission to share knowledge. Hari ni saya nak cerita pasal diabetic ketoacidosis pada anak ni. Okey tak, mak? Boleh tak? So get permission to share knowledge. And that knowledge you give in small pieces. Use simple language. Emotions, you explore and explicitly recognize the emotions and empathize with all those emotions. And S is strategize and summarize. So you buat conclusion bersama-sama. You buat plan of action together with the patient and the parent. Okay, kita nak makan ubat. Ubat ni kena makan oral 3 kali sehari kan? 3 kali sehari, betul. So nak bagi ubat ni macam mana? Macam cara nak bagi? Bila nak bagi? Kalau ubat habis nak macam mana? So you make the plan of action tu bersama-sama. Kan? Bukannya you yang bagi. Okay, macam ni. Ikut no. So you make the plan together with the patient and parent. So they are together. The care of the patient is not being ordered upon them, but they are involved in the planning of the action. And This is another important element, call for help. Maknanya always offer to discuss with him. This one is, saya tengok junior doctors and medical students are very poor. Offer to discuss with seniors. Okay, kita dah discuss pasal kes ni.
Adalah dimaklumkan berkat kederaan tahun 2022 bagi warga kerja.
Okay, so call for help mean, so you say for example, so okay, puan, kita dah cakap pasal isu ni dah sejam, dah lebih setengah jam kita discuss pasal kes ni. Mak faham ke? Kalau perlu mungkin kita boleh discuss, saya boleh mak nak jumpa dengan senior saya ke, kita boleh panggil senior MO, kita boleh panggil saya punya consultant lah kalau nak bincang. So you offer to discuss with seniors. Sometimes kan, even dalam exam, sometimes the parents ask questions that you don't know. Kan mak tanya, okay, ni kalau macam ubat ada problem dengan ubat ni, contohnya elektrik habis. Elektrik habis, blackout rumah. So insulin tu boleh pakai lagi tak? Kan? You don't know the answer. Sometimes I've seen student digoreng. In medical, there's no such thing as goreng. There's no such thing as you just creating, ni saya rasa tak ada masalah mak, saya rasa okay. No, if you don't know, you say you don't know. Minta maaf, saya tak pasti pasal benda ni. Sebab saya tak pasti, saya akan check dulu. Mak bagi masa, saya akan periksa, saya akan baca sikit dulu dan saya akan tanya dengan senior, saya akan tanya dengan konsultan, dengan pakar saya. Nanti saya akan maklumkan balik. Ataupun mak tunggu sekejap, saya pergi tanya dengan pakar. So it tells us that you actually know your limitation and you know when to ask for help, when you actually need to ask for help. Kalau you main kaki goreng saja, it tells us that you are not safe. Kan? Kes yang you tak tahu pun you main belasah saja. So that's not right. That is a dangerous doctor. So as a doctor, you need to know your limitation. If you don't know, you say you don't know. If you're not sure, you say you are not sure. Kan? You jangan main pandai-pandai je. If you don't know, you say I'm not sure. I will read it back up and probably in next one day or even next hour, I'll get back to you. Even as consultant at my level now, if I don't know, I always tell my patient I don't know. I have patients who are under my care for years already, which I'm still not sure about the management, and I've been always discussing with other consultants. That's usual. Even I told the mother, minta maaf mak, penyakit anak ni is beyond my level. Dia bukan level saya. So level penyakit anak ni memang saya terpaksa discuss sama lain. Mak tanya, I say, minta maaf, I really don't know. I'm not sure. I'll discuss. Saya akan refer, saya akan rujuk. So always offer to discuss with senior, always offer to refer. Mak nak saya rujuk kepada psychiatrist ke. So refer to other department. Nak kita panggil orang lain, nak jumpa doktor lain dan so on so forth. Nak dapat second opinion ke, whatever. So offer to discuss, offer to refer and offer to follow up. Okay, kita dah discuss setengah jam dah ni. Banyak benda kita discuss ni. Kalau nak, kita boleh arrange satu lagi session untuk kita tengok balik apa-apa benda yang tak faham. Offer for follow-up session. So this is what you need to do. It's very, very rare for me to see your seniors doing this properly. Kebanyakan tak buat pun. Okay, other aids that you can use are visual aids, charts, drawing. Sometimes you nak cerita pasal last exam dapat masuk pasal ventricular septal defect, VSD in failure. Sometimes it's good for you to actually draw VSD ni dekat mana, how VSD causes heart failure, for example. So sometimes you need to use visual aids, charts and drawing to make the communication understandable and effective. Yep, that's it. We are done. Slightly more than 1 hour. Any question? Clear? Tidur belaka? Seorang dia on camera. Ashraf. Orang lain tak ada. Muncul tak orang lain ni? Any question? Faham? Tak faham?
Doktor nak tanya. waktu exam main OSCE tu kan ada yang bagian consultation kan. So kiranya doktor assess juga apa yang kita orang tahu dan masa sama doktor assess apa yang kita orang tak tahu. So kita proceed macam mana kalau kita orang tak tahu lah. Maknanya refer macam yang tadi doktor cakap, referring tu lah.
Yelah, that's okay. Because the thing you need to understand is no one knows everything. There's always someone who knows better than us. There's always someone who knows better than us. Whatever your consultant, whatever level, there's always someone who knows better than you in other elements. I'm a neonatologist. I can't say I know 100% about neonatology. There are many aspects of neonatology that I don't know. So I need to refer, I need to discuss as well. So there's always like that. So a safe doctor, a good medical student who is gonna be a safe doctor always acknowledges the shortcomings. Saya tak berapa pasti pasal benda ni. Sepaham saya dia macam ni. Tapi saya akan check balik dan saya akan bagi tahu. So you need to be safe. Kan? If you don't know, if you don't have any idea, you say, I'm very sorry, I don't know this. I should know more. But what I'll do, always bagi, you tak boleh kata, saya tak tahu. Dan cukup cakap tu, no. That's not right, that's not safe. A safe doctor will be, I don't know about this, but I'll check, I'll look at some literature, I'll discuss with my colleagues, I'll discuss with my consultant, with my seniors, I'll discuss with other specialists, and then we'll have another session for us to discuss. Then I'll call you back, for example. So it tells us that you are safe. You know your limitation. Kan? Sometimes you have some idea. Okay, I only know a little bit about this. So from what I understand, it's like this, and this. But I'll give a bit more reading. I look at some of the more recent literature, and I will discuss. So never goreng. So goreng, you don't do goreng as a doctor. Kalau nak goreng, you jadi politician atau jual insurans, itu boleh goreng. Kalau tak, as doctors, you only tell the facts. Facts does not mean truth. Facts are what is available on the evidence. That is the acceptable truth. It can be true now, but probably it may not be true in few years' time when you have more evidence. Okay, any other question? Boleh. So for your batch, I expect a better punya communication punya session. I expect you guys to perform better in the man of ski. Okay, alright. No question. I don't know whether your other 32 friends ni are they alive or what. I'm not sure.
Ada doktor.
Ada? Hidup Okay, alright. Fine. Kalau semua masih hidup lagi, let's end our session with tasbih kafarah. Assalamualaikum warahmatullahi wabarakatuh.